Nearly 30 million Americans suffer from migraine headaches. Many try to get by on over-the-counter remedies which offer little or no relief. In our cover story, Rod Starnes takes a look at the pros and cons of some prescription medications and one new drug that's showing promising signs of managing migraines.
Christina Edwards has had to deal with migraine headaches nearly half her life.
My first migraine was at the age of 17, and of course I really didn't do much, just over-the-counter medication.
Little help there for the type of pain migraine sufferers describe as excruciating. But there are more powerful options available, as Christina discovered soon after taking a job as a medical transcriptionist for Sims Murphy, a neurology clinic.
It was kind of like a learning process. You know, when I got into the medical field, I kind of learned that there were actually treatments available.
Christina's case is typical. Sometimes migraine patients just don't know what treatment options are available. That's why it's so important to talk to your doctor.
We have a lot of newer drugs now that we didn't have in years past. Since 1994, we've had the triptans, starting with Imitrex, and there are about at least six different triptans, and each person is different. One triptan may work for one person and not another. The main problem with triptans is people with coronary artery disease cannot take it or should not take it. We've had two of our seizure drugs approved for migraine, valproic acid or Depakote and Topamax or topiramate, and they are very effective at reducing the headache frequency and sometimes even preventing them year-round. Of course, they have side effects. Depakote in young women, it can cause birth defects, and there's some fertility problems with it.
Now, a new drug, actually a combination of two older drugs, has recently received FDA approval for treating migraines.
The one most recent release is Trexamet from Glaxo, and they sort of combine naproxen, which we find in the leaf, with their original drug Imitrex, and the two together work very well.
Of course, what we put into our bodies can make migraine matters worse. Certain foods and alcohol can be problematic, so you want to make sure you discuss those issues with your doctor. While you're in the office, your doctor might have some other preventive advice as well.
If you go to a headache clinic, the first three things they'll tell you is stop smoking, stop smoking, stop smoking. So we have a high failure rate in smokers because the nicotine gets there first.
While that wasn't a problem for Christina, she is making sure to follow all of her doctor's orders closely. And while she still experiences the occasional flare-up, her migraines are now manageable. Good thing, too, because she's definitely a woman on the go.
I just didn't have the option to shut down, you know, because I do, yes, I have two children. I had to come to work. I couldn't take off. So I had to, you know, you just have to keep going. If I didn't have the medicines that I have now, I know that I would not be doing well.
For Smart Medicine, I'm Rod Starnes.
Joining me now is neurologist Dr. Lance Wright. And Dr. Wright, welcome to Smart Medicine.
Thank you. I'm glad to be here.
What is the difference between a migraine, a tension headache, and cluster headaches?
Well, cluster headache is a very specific type of headache, and it's the only type of headache which is more common in men. Cluster headaches are the most severe headache in most people, and it's what people are referring to when they say a suicide headache. It's an extremely severe, boring headache, usually around one eye. And the key is it's accompanied by certain other symptoms, which usually include a droopy eyelid, a stuffy, runny nose on that side, sometimes a unilateral sweating on just one side of the face. They usually occur 2 to 5 times per day, and fortunately are usually an hour or less. But when they're there, they're just absolutely horrible. Now, there's less of a difference between migraine and tension headaches. We tend to call it a migraine if people have throbbing, light sensitivity, sound sensitivity, nausea, or if it's on one side of the head. And we usually call it a tension headache if it's a more constant pressure or tight kind of headache. But there are a lot of people who get both, and the two types of headaches are probably related to each other, and the distinction is somewhat artificial.
Do certain foods have an effect?
They do in some people. Only about 20% of people with migraines have headaches that are often triggered by foods. But in the people that do have food as a trigger, it's often a very powerful trigger. And the triggers can include chocolate in some people, preserved meats with nitrites in them in some people, and various foods that contain a high amount of a substance called tyramine.
I know you have to take each case by case, but
that's right.
Generally speaking, what's the treatment regimen?
We have treatments that we give people when they get a migraine headache to knock out the headache. Just that headache, just that day. And there are a lot of people who have headaches really often. In fact, about 4% of the population of this country has what's called chronic daily headache disorder, which is a tendency to have headaches more often than you don't. And a lot of those people have a headache every day, or all day and all night every day, and this can go on for years. But people with frequent migraines are also treated with what's called migraine preventatives. These are prescription medicines you take every day, whether you have a migraine or not, which are designed to cause you to have fewer migraines. We've got about 10 different migraine preventatives, about 10 different things you take when you get a migraine. And basically, it's a big trial and error process to figure out what works best in an individual person and what is well tolerated in an individual person.
Dr. Lance Wright, thanks so much for being with us today on Smart Medicine.
I enjoyed it.
All right. To learn more about this topic, head on over to WKNO.org and click on the Smart Medicine icon, or check out smartmedicine.tv.